once you undergo an angioplasty or once you undergo a bypass surgery, what is the medication you are going to, how long you are going to continue? Lifelong. If that is the case, start this medication before you get these episodes. Prevention would require early recognition. Once you are 30, 35 men and 45 women, you need to take stock of this, your risk, and then see whether you are one of those who are likely candidates. There are heart attacks even before 30 years, before each 30 years. There are some of them who are at 20, 30 who develop heart attacks, but that is due to unusual risk. So once you detect this, then you have these medicines which will work. Now, there are many who ask question, how long to take? My simple posture to them is, once you have a heart attack, once you undergo an angioplasty, or once you undergo a bypass surgery, what is the medication you are going to, how long you are going to continue? Lifelong. If that is the case, start this medication before you get these episodes. Simple as it is, because there is enough evidence to say that prevention works, and it has been established in patients who have undergone these procedures, who have had a heart attack, where they continue to take medicines lifelong. So the simple logic is, start taking these medicines before you get a heart attack or before you get any one of these symptoms and procedures. So that is a simple logic, and that is needs to be applied intensely for you to save yourself from heart attacks. It's quite simple, and if you are to look at the test that is required, you can do all of the tests which you know of, but this particular test will give you a clear-cut indication where you stand. You don't repeat it. You repeat it not before 3 years after the first test. In your lifetime, you don't repeat more than 3 times. You don't need it. So this is the model that is available now, and this has been there for quite some time. Now there is enough evidence that is available to support this particular preventive strategy. So all that you need to do is think a bit and think whether you should involve in prevention of a disease as deadly as heart attack. Still, I'm at a loss to see why many of them, or I'm sure many of you among us here, are also not thought about, ಅಲ್ಲ ಇದು ಬರದೇ ಇರುವಂಥ ಒಂದು ಇದು ಯಾವುದು ಕಾರ್ಯಕ್ರಮವನ್ನು ಯಾರು ಮನಸ್ಸಲ್ಲಿ ಇಟ್ಟುಕೊಳ್ಳೋದಿಲ್ಲ ಅಂತೇಳಿ, ಬಂದರೆ ನೋಡೋ ಅಂತ, ಸಂಕಟ ಬಂದರೆ ವೆಂಕಟರಮಣ ಅಂತೇಳಿ. That is the usual approach. Well, heart requires harder look at than what we are now doing. And I've gone through all these interventions in thousands. There is no doubt, I have no doubt. They are all for us interventions. Prevention is for you, and it is for your own good that you think about your heart. All that you need to know is think about it and see how to prevent it. The point then arises, why this test is not recommended elsewhere. Mangalore has so many centers, so many hospitals, so many medical colleges. Any new development grows only if all stakeholders have equal interest in the change. Otherwise, it will be the primary, personnel who is involved in healthcare, like doctors. If he is not into prevention, he is not going to promote it, because even, generally we are interested in intervention. It's quite attractive. It's quite dramatic. What you prevent is not seen. What you cure is quite dramatic. And we remain with that. And we are interested in that, intensely interested in interventions. So as a result, it is being given a cold shoulder simply because it doesn't suit us. That's it. There's nobody to be blamed. If there is somebody who needs to take it forward, is people, the beneficiaries, and not the rest of the healthcare system. What I suggest is prevention is the most important thing.